If your child gets sick, if you take a bad fall, we're faced with uncertainty about where to go for care, especially if your doctor's office is closed. Do you go to urgent care or straight to the ER? Well, here to talk about navigating the appropriate levels of health care is Dr. Bio Curry-Winchell, the Director of Urgent Care Services at St. Mary's. Thank you for your time.
Oh, thank you for having me.
She's due in like 5 weeks. Doesn't she look great?
Thank you.
Darling, thank you for being here.
Thank
You're
you
busy.
for the invitation.
Absolutely.
Yes.
Okay, so, as a mom, you already know, if something happens, you're panicked and stressed. Where do I take my child? Should you go straight to the ER, or what's the difference between the two?
That is a great question. So a lot of people wonder, when do I utilize an emergency room versus an urgent care? So urgent care is wonderful for those same day services, such as a bladder infection, ear infection, sore throat, as well as we can handle broken bones. We do have imaging, especially at St. Mary's Urgent Cares, we have that. Versus emergency room are for more complex, critical issues. And of course, an emergency room is open 24 hours, 7 days a week. So if it's anything complex like chest pain and so forth, please go to the emergency room.
Always.
Yes.
So let's talk about that. Chest pain, broken bones. What are some things that are kind of non-negotiable? Get to the ER as soon as you can.
Chest pain, 100%.
Okay.
Severe abdominal pain, seizures, passing out. If you've had any loss of consciousness, I really highly recommend that you go to the emergency room. But one thing to remember, if you're closer to an urgent care and it's critical care that needs to be done right away, utilize your urgent care, because they could stabilize you until REMSA is called and go from there. So it's all about what resources are closest to you, and then going from there.
And are you noticing a lot of people going to the ER who shouldn't necessarily be there?
Yes, that does happen quite often, but it's so hard when, if your loved one is sick or if you're sick, it's hard to know, where do I go? So I'm just happy that they use resources and get help, but the urgent care is a great resource to be used. Like I mentioned, if it's a sore throat, bladder infection, we have so many things available, especially one of our new locations on Charlene. We actually have pharmacy, we have imaging, so that urgent care can do a great amount of services.
Right, the old Scalari's building.
Yes,
right?
that's where we're at.
Good to hear. Thank you. Trust your gut, bottom line.
Yes.
All right, doctor. Thank you so much. Good luck with that second baby girl.
Thank you very much.
If you have questions, give her a call until 6 tonight, 858-2222.